The SA Society of Psychiatrists says pregnant women using drugs, tobacco and alcohol need help, not judgment. The rising use of illegal drugs is mostly among women of reproductive age. Let's discuss this some more with Dr. Ronell Williams, who's a member of the South African Society of Psychiatrists, and she joins us virtually from Cape Town this morning. Dr. Williams, thank you so much for your time this morning. These figures, this latest data showing the rising use of illicit drugs, especially among South African women of so-called reproductive age, is some cause for alarm. How are you and your colleagues in the psychiatric industry, or sector, I should say, seeing this play itself out among such an important age group amongst women?
Yes, good morning, and thank you for having me to have this important discussion. So what we are seeing is that as the data that you're talking about, there's been such a significant rise in the use of illicit drugs, not just amongst men, but also in women. And the problem with women using during their reproductive phase is that a lot of the times they're using during pregnancy, and this has got such negative impacts on the outcome of the pregnancy, as well as the development of the fetus and the baby at a later stage. So we are seeing that in pregnant women that present with substance use or mental health illnesses, as well as the children later with some significant mental health or substance use disorders.
What are some of the external factors that is fueling this data? We know that South Africa is a very unequal society. Poverty is on the rise. There's the issue around unemployment. And of course, that's before you even talk about intergenerational trauma that especially this age group is having to deal with. In your experience, what are the factors that fueling these figures?
Well, the ones that you've just mentioned are quite important, but I think from our perspective is the fact that a lot of these women have underlying psychiatric conditions, and the most common ones would be depression and anxiety, and this can lead to them trying to self-medicate with these substances because there's so much stigma around either mental health or using substances in general, even more so while being pregnant. And then, of course, our socioeconomic factors, the low education levels, high poverty rates, as well as the fact that we're seeing more extended responsibilities that's put on women, single women-headed households, apart from the trauma that they've experienced that you mentioned.
Now, we've all seen the numbers that our ratio in terms of citizens to how many people actually have access to psychiatrists or psychologists is a really bad ratio in South Africa. So people don't have access to the help that they may need. What is your advice to people who feel like there is somebody in their life that is at risk, that does need help, the young women that we just spoke of? How should they address the matter to ensure that that person gets help and is not just judged by society?
Well, I think the first thing is seek help with a healthcare provider. And it doesn't necessarily have to be a mental health care provider, but both is available to anyone. If you recognize any of these in yourself, young teenagers or early adulthood who are pregnant or using substances, you can access your local day clinic and either see a health professional there. And because there's a lot of stigma associated with it, they are the highest risk at not wanting to go or not attending appointments. So what we're saying is if you're worried about stigma or judgment, then you can also access the mental health sister at your local clinic.
We're going to leave it there. Thank you so much for that much needed advice, and hopefully somebody watching right now perhaps just needed to hear that this morning, and we have been able to help them. Dr. Ronell Williams is a member of the South African Society of Psychiatrists, joining us virtually there from Cape Town. We thank her for her time.